Now, senior public health officials in England have cast doubt on the government's plans to roll out mass testing across the country following a successful trial in Liverpool. The Association of Directors of Public Health say there is a lack of resources and people to conduct the plans for mass testing. They say it would be better to continue to target testing where it's most needed. The government says it's talking to councils to make sure their needs are met. On the line now is Alison Pollock, Professor of Public Health at Newcastle University. Good evening.
Good evening.
The government is spending £100 billion on this mass testing plan. What's your view of it?
Well, £100 billion is more than 70% of the total annual budget for our NHS, National Health Service. And it's a completely unevaluated experiment. It's an enormous, tremendous diversion or even a waste of resources. Because what the government's going to do is testing millions of healthy people for unknown gain. And even if we do find people who are test positive, many of them may not be infectious. So it would be much better to focus on getting the basics right, which we've not been doing. And that's finding people with symptoms, isolating them, testing their contacts, and paying people properly to isolate, because unfortunately the contact tracing is not very effective at the moment. So we're going to be using a lot of resources on healthy, well people instead of focusing them. And also we should be rebuilding our health services. So this is a tremendous lost opportunity, £100 billion, 70% of the total NHS budget. There's another issue, which is that this is a screening programme. This is a massive experiment. It's not evaluated with no ethical approval. It's just not the case that the Liverpool experiment has worked, because the rates of infection were falling. We haven't seen any evaluations to date, and we don't know whether this has had any effect at all on breaking the chain of transmission. So we have no evidence for this, and yet the government is continuing to roll it out, instead of inviting the UK National Screening Committee, which has all the expertise to come in and do this. And that's why we're arguing this experiment needs to be paused, stopped, and the UK National Screening Committee come in and give oversight and advice. This has all been done in a huge rush.
So not just in a huge rush, but you are obviously hugely critical of this. So when you say that the Liverpool, the trial that in Liverpool is not the success that the government is telling us, do you think that they are not being transparent? It actually didn't work?
Well, the people of Liverpool were told the test was for a test for infectiousness, and it would break the chain of transmission of the virus. This isn't true. We're now being told it's a trial. It's a trial of tests and evaluation of testing regimes. So the public haven't even been told what the purpose is. This is a huge, expensive experiment using hundreds of millions of pounds of resources for a service that we have never evaluated, and we don't know whether it works. And I have to say the other big problem is the problem with the tests. If you look at the information sheet for the tests that the government's been using, and they spent billions of pounds on these tests, they say they are not to be used on healthy people with no symptoms. They're not tests of infectiousness. They're only to be used as a support for doctors who are making a clinical diagnosis. In other words, in people with symptoms. So here is a government, it's hugely unethical, this experiment. It's rolling out tests that have never been evaluated or validated for use in the community and used on healthy, well people. And it's spending billions of pounds on this project, which is why it needs to stop now.
Okay. We will have to leave it there. You've made your points very clearly. Alison Pollock, Professor of Public Health at Newcastle University. Thanks.